AOSIS is proud to be hosting this book launch, Unlocking Knowledge to the World. We are pleased to announce the release of the Health and Veterinary Sciences Open Access book, Working with Indigenous Knowledge, Strategies for Health Professionals. The University of Pretoria in South Africa has generously supported this publication by AOSIS Scholarly Books. Get a first-hand view of the engaging conversation from its subject specialists.
My name is Dr. Lebese, a senior lecturer at the University of Pretoria and one of the authors of this book. Thank you so much, Lorica and AOSIS, for your professionalism and inviting us for a book launch titled Working with Indigenous Knowledge, Strategies for Health Professionals. I would like to thank the authors of this book, including the editors of this book. I'm with the panel members, Prof. Mulaudzi and Prof. Lebese, the editors of this book, together with other authors of this book, Prof. Moa, Prof. Ramaboya, and Prof. Mulugupiri. Prof. Shirley Moa, you are one of the authors of this book, and you played a critical role in writing this book. I would like to know, what is this book all about?
Thank you, Dr. Sipeng, for this introduction. Yes, I'm part of the authors, and I played a very important role, especially on the introduction of this book. What I can say about this book is that this book tried to outline the African ways of living as far as health is concerned. This has been a very tedious work of around 2 decades, which was taking place at the University of Pretoria Department of Nursing, where the current Sarchi chair went all out throughout those years to involve indigenous healthcare providers as well as traditional birth attendants in working together in order to promote what is necessary for African society. The book is around 13 chapters, and it spans from the issues around childbirth, pregnancy, as well as even contemporary issues such as LGBTQ. So this is a good read for our healthcare professionals.
Thank you so much, Prof. Moore, for the introduction of this book chapter. Now I'll be starting with the questions to the panelists. Prof. Mulaudzi, you've been researching on IKS. I would like to know what inspired you to produce this book on IKS, specifically for healthcare professionals.
Thank you so much, Dr. Spain. It is indeed a pleasure for me to be part of this launch, more especially now that it is August and Women's Month. I'm saying this because the majority of the authors and the co-editors of this book are women. We are so delighted about this book. Indeed, as Prof. Moa has already said, this book spans from research that has been done for the past decade and the collaboration that was going on between different scholars, transdisciplinary. We have people from human nutrition, nursing, and agriculture who have been part of this book. The main aim of this book is to advocate for indigenous knowledge system. If we look at our healthcare system currently, it is still monolithic. We talk about modern healthcare, and indigenous knowledge is always overlooked. So a lot of research has been done on indigenous knowledge, but it remains in articles and in libraries. So the main aim of this book was to ensure that we write about indigenous knowledge system so that the information can be accessible to health professionals who are doing research and also health professionals who are in the wards nursing patients so that they can be able to understand the cultural domains. And the timing of this book is so correct, because if we remember the Feast Must Fall campaign that happens in our country, one of the things that was asked by the students was the decolonization of the curriculum. Yes, that can be done, but we need textbooks that will support what we will be talking about. So this book has been written by scholars who have been doing, some of them have been doing masters, some of them have done PhDs in indigenous knowledge, so they have turned their thesis into chapters. So it has been a very interesting project, and we think we'll have an opportunity to even do more of these books, for we would like our colleagues in Africa to have access to information, more especially traditional health practices that have been overlooked, that are critical. We have seen that during the period of COVID-19, when we were realizing that the hospitals are full, we had no option except to go to our backyards and get herbs that really assisted us a lot. And that is what we have written in this book. I think Prof. Lebese, my co-editor, will be able to expand more on what is in these different chapters that have been written in this book. I thank you, Dr. Sipeng.
Thank you so much, Prof. Mulaudzi, for a wonderful and thoughtful information that you have shared with us. Prof. Lebese, as one of the editors of this book, I want to hear from you. Could you explain to us what are the chapters of this book focusing on?
Thank you, Dr. Sipeng, for the opportunity. This book has 13 chapters that address different aspects related to indigenous knowledge and its implications to health. I will discuss each chapter separately. Chapter 1 focuses on communication discordance between healthcare professionals and indigenous patients. And you'll agree with me that language barrier, it's a problem, and interpretation of what the person is talking about is very important in making a proper diagnosis. And chapter 2 deals with indigenous health promoting and prevention practices, which even overlaps to the next chapters, which is chapter 3 and chapter 4, because in the chapter 3 we are exploring how wearing of artifacts promote and prevent diseases. Chapter 5 also deals with how we indigenous people conduct child spacing. What are the practices related to child spacing? I will come back to chapter 4. Chapter 4 focuses on the rite of passage for different cultural groups and different age groups and its implication to health. I've grouped the next 5 chapters together. That is chapter 6, 7, 8, 9, and 10. In these chapters, there's an exploration of indigenous practices in relation to the promotion of health and prevention and treatment of diseases. And these are the areas that we have focused on. Chapter 6 focuses on pregnancy, birth, and after birth. And chapter 7 focuses on neonatal care. Chapter 8 focuses on menopause, and chapter 9 is STI, and chapter 10 is mental health. All these chapters look at what are the indigenous practices in relation to promotion of health, prevention, and treatment of the different diseases that I've mentioned. Chapter 11 gives an integrative review of same-sex intimacy relationship and marriages. And the following chapter, which is chapter 12, has explored the role of patriarchy in its influence on domestic violence against women and children. And lastly, chapter 13, we have explored the different edible indigenous vegetables and their impact on health. It is our hope that this book will bring back the dignity and creativity to the traditional healthcare and knowledge system locally and internationally. I thank you, Dr. Sipeng.
Wow, that's wonderful. Thank you so much, Prof. Lebese, for summarizing the book chapters. And now, Prof. Ramaboy, as one of the book co-authors, could you kindly explain to us about your chapter, which focuses on indigenous practices in healthcare promotion and disease prevention?
Thank you, Dr. Sipeng, for the question. I wrote this chapter with my colleague, Dr. Nesengani Victoria. We are both primary healthcare nurse specialists. Hence, this chapter is on health promotion and disease prevention. So, looking at how this can be achieved using indigenous practices. So, the main aim of this chapter is to remind and bring awareness to the healthcare professionals on indigenous practices in healthcare promotion and disease prevention that works. As such, the chapter documented the role of healthcare practitioners regarding health promotion and disease prevention in primary care setting, which is the family and the community. Apart from that, the chapter also emphasized on the role of indigenous practices. These are the practices which are done by elderly people and other people apart from traditional practitioners. So their role also included, and the way people do promote health through traditional chores, cultural dances, consumption of the indigenous vegetable, fruits, and edible insects were also entailed in the chapter, so that they see how using those exercises, cultural exercises, eating fruits, vegetables, and then insects will help in promoting the health of the community, especially young ones, because things like insects and fruits and vegetables, they also prevent malnutrition, which is a problem now currently in our community. We also indicated the taboos, cultural transgression, and their values in health promotion and disease prevention, so that our healthcare professionals are aware of those and encourage our people to utilize them. Also, within the role of the traditional healthcare practitioners, the chapter entails the role of rehabilitation, because our patients, when they are discharged out from the hospitals, they go to the community, they go also to their families where traditional or indigenous practices are being performed. So we include the role of rehabilitation on it, and also the challenges that traditional healthcare practitioners, they do face, especially with regard to referral systems, and they are not recognized, they are stigmatized, they are called by names. So in conclusion, in the chapter, what we are trying to do is to inform the healthcare professionals, to conscientize them so that they understand indigenous practices that are used in health promotion and disease prevention, so that they avoid judging their patients. Hence, they can embrace the practices, they can accommodate the practice and encourage the patient and the community to adhere to the practices which are good, which are safe for their health, and discard the ones which are harmful. So in other way, the other things that we tried to bring on was, because we talked about stigmatization, we want to indicate or to say, let us avoid stigmatizing indigenous health care practices, because we know these are the things that they were practiced previously, they are still being practiced right now. We've seen also in the time of COVID, as indicated by Prof. So stigma must be avoided because it is associated also with indigenous practices. And then the use of indigenous practices in this way will also assist or will promote collaboration between the Western and the traditional practices. In this way, our health of the community will be improved if we are encompassing both of it and we are embracing it. Thank you very much.
Thank you so much, Prof. Ramaboy, for sharing insightful information with us. And now, Prof. Mulukupiri, how does this book contribute to the body of knowledge in healthcare profession and across disciplines?
Thank you, Dr. Sipeng. The academics in healthcare sciences, this book useful, and it will empower them with knowledge and guidance, which will allow them to understand indigenous knowledge, methods of care, indigenous disease patterns, cultural beliefs and practices of the communities they serve, and also assist them in teaching students cultural safety care. The Indigenous Knowledge System in healthcare focuses on sharing indigenous knowledge and practices that are culturally specific. The focus was on identification of indigenous ailments and that affect all ages, their diagnosis and assessment, as well as healing modalities. The holistic nature of healing was displayed in this book. This book documented the significance of indigenous knowledge system, customs, practices, and indigenous healing modalities used to protect and prevent diseases. This book also highlighted the different causes of diseases, the importance of belief systems, attitudes, and practices of the patients in understanding diseases and treatment modalities. Thank you. Thank you, Dr. Sipeng.
Thank you so much, Prof. Mulukupiri, for that wonderful information. Over to you, Lorika.
Thank you. As you explore the book and its contents, and any queries arise, please reach out to the editors via contact details provided within the book. We value the time you have invested discussing this book's discourse and anticipate the grand height this book will reach.